Bipolar disorder is a psychiatric condition diagnosed over a period of time by certain criteria set by the American Psychiatric Association. It is the two poles of your mood, really high, which is manic, and really low, which is depressed. Most of us live somewhere between those two poles, and hence it's called bipolar, meaning two poles. But a bipolar patient who has the disorder is truly plagued by being at one end or the other and really finding it very difficult to find the middle ground of their mood. And this is based in biology of your brain and a dysfunction, as well as environmental factors. Bipolar disorder is caused by several factors. Biology, meaning genetics and it's inherited, to the environment with which you lived, to traumatic experiences that may have shaped you as a young child. Nonetheless, it is a shift of your brain chemicals within your brain at a rate that is faster than typical, which then adds to the flux of your mood from really high to really low and the anxiety that goes along with that. The difference between bipolar Roman numeral 1 and bipolar Roman numeral 2 is the amount of times, which are called cycles, that a patient will cycle between the two poles of their mood, really high and really low, in a set amount of time. All of this descriptive criteria is built within diagnosing it from the American Psychiatric Association. There are many different kinds of treatment options for bipolar disordered patients, anything ranging from medications to individual therapies to acupuncture to meditation to hypnosis. So there are various ways to treat it depending on what are the circumstances around that patient and the life and the outcome that they would like. There are several medical and mental health or psychiatric conditions that can mirror or mimic bipolar disorder. Anything from someone who is depressed, who may really be bipolar in their depressed phase, to anyone who has ADHD or may seem manic, to anyone who may be somewhere in between and very anxious. So there are many masquerading symptoms and features to bipolar disorder, hence the reason why, in order to diagnose it properly, you need to watch a patient and know their history over a period of time. The quality of life for bipolar patients is really dependent upon their connection and commitment to treatment. The people and the patients that will go forward and make that commitment to be treated and to stay connected to that treatment and be consistent with that treatment will have a much higher quality of life than the patient who either does not commit to treatment or only sporadically commits to treatment, because the more time that your brain spends balanced with the medications and the supportive interventions, the better and more steady your life and therefore the outcome of your life will be.